Well, joining me now is Alvaro Bermejo from the HIV/AIDS Alliance. Alvaro, thank you very much for joining us today.
Thank you for inviting me.
First of all, what is the extent of the HIV/AIDS problem in Commonwealth countries?
It's a huge problem. The Commonwealth has 20% of the world's countries, 30% of the world's population, but nearly 2/3 of the world's people living with HIV, so a very big problem in Commonwealth countries.
Now, we've seen in some countries there's legislation that bans men from having sex with other men, issues opposing sex workers, or even punishing people who transmit HIV/AIDS. What are the health implications of this legislation?
The International HIV/AIDS Alliance works in 16 of these Commonwealth countries, reaching about 1.2 million people. So we really have experience of what's happening on the ground, and we're seeing the effects of legislation that is not allowing programs to really reach those that need them most. There are groups like men who have sex with men, like sex workers, like injecting drug users, who are at increased risk of HIV, but because of these legal frameworks cannot be reached. We cannot design programs for them. They feel reluctant to access services, whether it's prevention or treatment. You see that they are underrepresented in those receiving care and treatment, but they have much higher prevalence of HIV than the general population. So we really need to change that to control the HIV/AIDS epidemic, and it's very important that countries realize that these laws are getting in the way of good public health. So there really is a human rights argument, but also an important public health argument to change these laws.
Now, your organisation sees on the ground the extent of the HIV/AIDS problem, but how are you working with other partners such as the Commonwealth Foundation to kind of bring about change?
In these countries, what we've seen is that the legal frameworks are very similar. So Section 377, for example, that criminalizes same-sex relationships, is common to about half of the Commonwealth countries. So they can really learn and get inspired by the experience of some countries who have really changed it to realize the impact that has on the epidemic and learn about the processes to get to that change. So we thought that the Commonwealth Secretariat and Foundation were great partners in this fight to reach law reform that really takes into account the public health needs of people living with HIV and those most vulnerable to it.
And can you give us an example of where you've seen some changes?
We've seen a number of countries take positive steps to, for example, repeal Section 377. The most recent one has been India through the High Court of Delhi, which has really come down on this, ruling it unconstitutional, really on the basis of an appeal that had been presented by the NAS Foundation, by a civil society group, on the basis that it did not allow an appropriate response to HIV. And the interesting thing was that the government of India came divided, the Ministry of Health and the National AIDS Control Organization sort of supporting the repeal of that law, and the Ministry of Interior wanting it to stay. But the judge came down making a change, and we think that's going to be a very important precedent that other countries might follow that same path, and we hope they do feel inspired by this.
And so finally, why is reform urgently needed?
It's urgent because the epidemic is still causing devastation. We're still seeing 2.7 million new infections around the world every year, and it will not be changed in a sustainable way unless we can address the structural issues that are driving new infections. And law reform is a very important path to making those changes. And we've unfortunately are in a situation where the health profession, medical advances are leading the way, but law reform needs to follow very closely to make those changes sustainable. It's urgent, it needs to start now.
Well, I'll have to leave it there for today, but thank you very much for joining us.
Thank you, my pleasure.